Dr Stephen Middleton. I work at Addenbrooke's Cambridge University Hospital and I have a private practice at the Spire Cambridge Hospital. The SmartPill is a small capsule, just slightly bigger than the average pill size, which is swallowed by the patient, and it has 3 sensors on it which measure different modalities. It measures the amount of acid or the pH level in the body, the temperature and pressure. So as it travels through the intestinal tract, it sends recordings of these 3 measurements to a box, a receiver, which is about the size of a large mobile phone, and it transmits these for as long as it takes to transfer itself through the intestinal tract. Once it drops out at the bottom end in the normal way, then the reader will indicate that the SmartPill's come out of the patient, and then they bring the box back and we analyse all the data. So the SmartPill doesn't replace the standard investigations that you need to exclude things like ulcers, inflammation, polyps, tumours, etc. But what it does do is diagnose conditions where the movement of the intestine is abnormal. Up until now we've only had nuclear medicine tests that can do this, to work out how quickly food travels through the stomach, small bowel and large bowel. But that involves a degree of radiation. And it also is quite time consuming. Patients will have to go back to the hospital regularly and often spend most of the first day in and around the outpatient department at the hospital, and then they'll have to go back for several days after that, depending on how quickly things move through. With this pill, all they have to do is swallow it. It takes just a few minutes, and then off they go with the receiver, and they can do their normal activities for however long that takes. It can measure for up to around a week, but mostly the pill will go through in 24-48 hours. There's information about the SmartPill on my website and on the Spire Cambridge website on the internet. Or patients can contact the hospital and written information can be provided about the test.